The Autism Puzzle. Piecing together the pieces for a better understanding. Whether you're a concerned parent, caregiver, or just a curious cat having concerns about a child or young adult's developmental well-being, specifically autism, can be a lingering factor. We always strive to give our children the best opportunities for them to grow into thriving adults with little to no setbacks. Every child is different, but sometimes those differences need an alternate way of handling them properly for both the child's and the caregiver's sanity. Detecting those differences, learning how to maneuver those uncharted waters, and ultimately understanding what your child's needs are just a few themes we will be covering in this video. What is autism? The word autism is derived from the Greek word autos, meaning self. It was first used by Swiss psychiatrist Eugene Bleuler in 1911 to describe individuals who were withdrawn and isolated, and seemed to exist in their own world. However, it was not until the 1940s and 1950s that autism began to be studied in more detail and recognized as a distinct disorder. So, the term autism was originally used to describe a specific kind of social withdrawal and detachment, and over time, it has come to encompass a wide range of symptoms and behaviors associated with the disorder we now know as Autism Spectrum Disorder, ASD. Symptoms of autism. Autism Spectrum Disorder, ASD, commonly referred to as autism, is a condition that affects a person's social interaction, communication skills, and behavior. It is a neurodevelopmental disorder. It is characterized by a wide range of symptoms and severity, and is considered a spectrum disorder because individuals can have different combinations and levels of symptoms. A few signs often associated with autism are struggles in socializing, problems with verbal and nonverbal communication, repetitive actions or fixations, sensory processing issues, tiptoe walking. How common is autism? Autism spectrum disorder is a prevalent condition, with a reported occurrence rate of 1 in 54 children in the United States. Similar rates have been reported in other countries as well. Studies have also shown that the prevalence of autism has been increasing in recent years, although it is not clear whether this is due to changes in diagnostic criteria, increased awareness and detection of the disorder, or other factors. It's important to note that the commonness of autism can vary depending on the population, with some studies showing higher rates among boys than girls, and higher rates among certain racial and ethnic groups. Overall, autism is considered to be a significant public health concern, and research efforts are ongoing to better understand the causes of the disorder and to improve diagnosis and treatment for individuals with autism. Nature versus nurture? The true causes and reasons for the high prevalence of autism are not entirely known yet. However, studies indicate that a mix of genetic and environmental factors may be involved. Genetic factors: studies have shown that autism is highly heritable, meaning that genetic factors are likely to be involved in the development of the disorder. Studies of twins and families have found that if one identical twin is diagnosed with autism, there is a high likelihood that the other twin will also be diagnosed with the disorder. Furthermore, research has identified hundreds of genes that may be associated with autism, many of which play a role in the development and function of the brain. Environmental factors: while genetics are thought to be an important factor in the development of autism, environmental factors are also thought to play a role. Studies have suggested that certain environmental exposures during pregnancy, such as certain medications, maternal infection, and exposure to toxins, may increase the risk of autism. Additionally, research has shown that advanced parental age, premature birth, and low birth weight are also associated with an increased risk of autism. It's important to note that it is likely that autism is a complex disorder with multiple causes and that the reasons why some people develop autism while others do not may vary from person to person. Research in this area is ongoing and more information is needed to fully understand the underlying causes of autism. When and how autism is detected and diagnosed. Autism is typically diagnosed in early childhood, with the average age of diagnosis being around 2 to 3 years old. However, there are early signs of autism that can be observed as early as the first year of life. One of the earliest signs of autism is delayed language development. Children with autism may have difficulty with speech and language, such as not speaking at all, or only using a few words. They may also have difficulty with social communication, such as not responding to their name, not making eye contact, or not pointing to objects to show interest. Another early sign of autism is repetitive behaviors or interests. Children with autism may engage in repetitive movements, such as rocking or flapping their hands, or have a strong interest in specific objects or topics. They may also have difficulty with changes in routine or transitions, and may become upset when their routine is disrupted. Children with autism may also have difficulty with social interactions and may not be interested in playing with other children. They may prefer to play alone or with toys rather than engage in social play. They may also have difficulty with understanding social cues and may not understand the emotions of others. Tiptoe walking is linked to autism, however, other physical factors could contribute to this condition, such as a short Achilles tendon, cerebral palsy, muscular dystrophy, or even just habit, idiopathic toe walking. It is important to note that these signs may not be present in every child with autism, and some children may have more severe symptoms than others. Also, these signs may not be exclusive to autism and may be present in other developmental disorders as well. Major sign of autism. Many individuals with autism have sensory sensitivity, and this is often considered to be a core symptom of the condition. Studies have shown that a high proportion of children with autism have sensory sensitivities, particularly to touch, sound, and movement. Sensory sensitivity, also known as sensory processing disorder, is a condition in which the brain has difficulty processing and responding to sensory information from the environment. This can manifest in a number of ways, such as being overly sensitive to loud noises or bright lights, or having difficulty with fine motor skills. Sensory processing difficulties are common in people with autism, and they can affect the individual's daily life. Occupational therapy can help individuals with autism and sensory sensitivities to develop coping strategies and to improve their ability to process and respond to sensory information. Treatment options for autism. Early identification and intervention is important for children with autism, as it can greatly improve their outcomes. If you suspect that your child may have autism, it is important to speak with your pediatrician or a developmental pediatrician for an evaluation. With the right support and therapy, children with autism can learn to communicate, form relationships, and lead fulfilling lives. Occupational therapy is one of the main interventions used to help individuals with autism improve their ability to function in daily life. Occupational therapists work with individuals to develop and improve fine motor skills, self-care skills, and social skills, as well as to reduce problem behaviors. They also help individuals to learn how to better cope with sensory sensitivities and to make environmental adaptations that can improve their ability to function. Other interventions that can be used to help individuals with autism include speech therapy. Speech therapists work with individuals to improve their communication skills, including their ability to express themselves and understand others. Applied behavior analysis, ABA. ABA is a form of therapy that uses positive reinforcement to teach new skills and reduce problem behaviors. Social skills training. Social skills training helps individuals with autism to learn how to interact with others and to understand social cues. Medications. Medications may be used to treat specific symptoms associated with autism, such as anxiety, ADHD, or depression. Education and school support. Special education programs and support services can help children with autism succeed in school. It's important to note that each individual with autism is unique, therefore a multidisciplinary approach and tailored interventions will be the most effective approach. It is also important to involve the family and caregivers in the treatment plan to ensure the most successful outcome. Understanding and supporting individuals on the spectrum. Understanding someone with autism can be challenging, as the disorder affects social interaction, communication, and behavior in unique ways for each individual. However, there are some general tips and strategies that can help. Learn about autism. The more you know about the disorder, the better equipped you will be to understand and communicate with someone with autism. Be patient. Individuals with autism may have difficulty understanding and expressing themselves, so it may take them longer to process information or respond to questions. Be clear and direct. Individuals with autism may have difficulty understanding figurative language, sarcasm, and other forms of indirect communication. Avoid overwhelming them. Individuals with autism may have difficulty with sensory processing, so be mindful of the environment you are in and try to avoid overwhelming them with too much noise, movement, or other stimuli. Be flexible. The needs and abilities of individuals with autism can vary widely, so be prepared to adapt your communication style to meet their unique needs. Show empathy and understanding. Remember that individuals with autism are unique individuals with their own strengths and challenges, and that they may require special accommodations and support. Show empathy and understanding, and don't take their behavior personally. Seek professional help. If you have a friend or family member with autism, seeking professional help from a therapist or counselor can be very beneficial, especially if you're having trouble understanding or communicating with them. Listen to your intuition. Although it may sound cliché, if you spend enough time around your little one, you intuitively know what is working and what isn't. It's important to remember that every person with autism is unique, and there is no one-size-fits-all approach to understanding and communicating with them. Be open-minded and willing to learn, and always keep in mind that their behavior and communication patterns are a result of their condition and not a personal choice. In conclusion, autism is a fairly new discovery that still needs more time to research extensively. With this quick and general guide of what to look for along with a professional evaluation and diagnosis, there are a few helpful ways of caring for and understanding the special person in your life.